Alexa, turn off. Hi, everybody. Welcome to Tea Time with Bunky. Once again, I apologize if there is no music playing because I don't want to get grabbed and caught and the video is on pause. But as I was coming on, the song that was playing was Trusting You by Fred Hammond. Wish I could have played it, but God knows all things. I would like to thank all of my Tea Time with Bunky subscribers, the ones that have been with me from day one, a whole year and a half. To my new followers and subscribers, thank you and welcome. Um, I appreciate you. Remember, you can follow me on Facebook. You can follow me on YouTube. You can view the show after the fact. So if somebody misses the live, they can always go back on either YouTube or Facebook after you follow and subscribe and watch it again. Make sure you tell a friend and tell a friend, and what you've all been doing, because that's how Tea Time is growing. So I appreciate you. I want you to know that. And also, if you want a good laugh, you can follow me on Bunky Bunk on TikTok. Haven't really been on there that much, but I go on every now and again. So that's that with that. Reminder that elections are coming up. People, elections are coming up November 8th. November 8th are your elections. Find out who is running in your local towns, your local counties, in your state. Like I had this conversation with someone who only votes in the national elections. You need to know who's running your local government, because those are the people that are hitting you in the head. So know who these people are behind these posters that you see on the side of the road. Look them up. I don't think it's too late to register. I don't think it's too late. So if you're not registered, go register. You don't have to do this Democrat, Republican. I mean, you do have to register in the party, but the way I do it, I vote for whoever speaks to me. So you could be Republican, Democrat, whatever, but whoever speaks to me. But the way it's speaking, we going. All right. Well, tonight's show, October, as you all know, is Breast Cancer Awareness Month. My special guest tonight is a breast cancer survivor. She holds, I forgot my tissue. God dog it. She holds many hats. She's a mother, a wife, a daughter, a sister, a cousin, a nurse, African American nurse at that. And she's a breast cancer survivor. So without further ado, let's bring on Miss Nytishia Gillmer. Oh, look, she got company.
Always. I can't go anywhere without my little friend.
Hi. Hi, Nytishia.
Hi.
How are you doing?
I am doing well, thank you.
I'm doing good too.
How are you? Oh my
Bye.
goodness. She's always so bubbly, that one.
She has so much personality.
But that's an understatement. But yes, thank you.
Of course. I am honored to be here.
And thank you for being one of my top Tea Time with Bunky followers and subscribers.
You know I love you, Bunk. Of course.
I know. And for those that don't know, wait, let me put you up here. Wait. Nytishia, wait. Look, stuff popping up. It'll go away. When it go away, you can still see me, right?
Yep.
Okay, but when this jacked up mess. Okay, Nytishia is also my little cousin. For people that don't know, applause. Nytishia is also my little cousin. And I love and appreciate you. I want to get your stuff up here, but this I don't. There we go. Tell everybody a little bit about you, a little bit about you before we get into the whole.
I am 42, just turned 42, September 23rd. I have two daughters, Amara and Amiria. I have a husband, David. We've been together 14 years now. My girls are 12 and 5. I have been a nurse for 10 years. Just been a mother for 12 years. As I said, just there's nothing significantly special about me. Just trying to live my best life.
And you're super sweet. You're super sweet.
Thank you. I
You are.
try. I have my moments. I
You're.
try
I was
though.
gonna. I was gonna say you're a little rough sometimes
I
too.
can be. I
but
can be, and
it's
I own that.
that. And you know what? As you should. As you should. Now, I I didn't know that. I didn't know that you had breast cancer, and I'm your cousin, and that
Right.
just goes to show that people need to be in touch, reach out randomly, because sometimes it's in your mind to reach out,
Right.
but then life happens, time flies, and then you find out during another horrible situation that your little cousin went through this situation,
Right.
which is I think I apologize to you. If I didn't, I'm sorry. I didn't know. I didn't know. I
It's
just
okay. I didn't not a lot of people knew what was going on until I was ready to share. And that was until a good probably month after
you
I
went
had
through
my
it.
diagnosis. It was right before I went into surgery. And I only shared because I was scared. I was scared.
Now, when was your diagnosis?
So I
Wait,
was
wait, wait,
diagnosed.
wait, wait, wait. No, before your diagnosis,
Okay.
what led up to the test?
If I can be anything for anybody, I want to be an advocate for your monthly self breast exams.
Mhm.
Cause it was during one of those, I was like, hey, I have this tiny little, it was a pea-sized lump. And it was August, I want to say August 24th of 2020. I wasn't there before. I don't know what that is. And as a nurse, I've seen the worst of the worst. One of my first patients in the hospital was a woman who had breast cancer,
Mhm.
chose not to do anything about it, and was growing out of her skin.
Wait, what do you mean?
Yeah.
Like,
So her skin had opened up and the cancer cells were growing outside the tissue. Because when it was in a stage that she could do something, she didn't want to do anything. And by the time she could do something, it was too late.
wow.
So I panicked. My first instinct was to panic, and I didn't want to be like that. So the next morning, I called the doctor, and luckily, she could see me 2 days later.
Right.
She said, "Yep, I feel the lump. It's very small. I think it's a cyst, but we're not going to mess around." She's like,
Okay.
"I don't think it's going to be anything. You don't have any family history. I was a very healthy, I didn't get sick. I was
Okay.
very healthy."
Okay.
Um, so I went for mammogram and an ultrasound. I think
Mhm.
it was a week and a half later. Um, they were
So
like,
you
"We're not."
you felt it. You felt it.
Yes, yep,
Okay.
I felt it.
Okay.
So, and it's a good thing I did, because after the things I found out about it, it's a good thing I felt when I did. Um, about 4 weeks later, I went for, or 2 weeks later, excuse me, I went for a mammogram and an ultrasound, and they said, "Well, we see something
Mhm.
on your right side, but we also see something on your left side."
So you didn't feel it on both sides.
No, I felt the little pea-sized lump in the right side, and they saw on ultrasound and mammogram something on the left side.
Okay. Now let me ask you, being a nurse. Now I know, and me being a female of age, I've had the mammogram thing, right? Now, what made them do an ultrasound? Did you ask for that, or was it because of the lump
It
that
was
they did?
because of the lump.
Okay.
So I don't know if it's standard care now. Actually, I should really look into that, but
They didn't do it
because
last
I had
year for
never.
me.
Hmm?
I just got the one. I mean,
They,
last year when I had my mammogram, they only did a mammogram. They didn't do ultrasound.
okay, so I think because of the lump
Okay.
and where it was and what they saw on ultrasound, the mammo they sent me for the ultrasounds.
Okay.
So it's not standard care, I guess, but
Okay.
they were like, yeah, something doesn't look right. We can't tell from what we've done so far what it is. So we're going to take the next step.
Now, how long after that? Now, when you had that, while you're waiting for those results, right? What's going through your head?
I'm freaking out every single day. I'm freaking out every day because they actually ended up doing 2 biopsies. So you never want to think it's going to be something, but in my heart, I just knew it was something. I knew.
You knew
In my
it.
heart of hearts, I knew they were going to find something. I thought they were going to find something on both sides, but I just knew. So I was scared for what they were going to find. I was scared for what was about to happen to my family, what I had felt, the guilt I carried for what I had just done to my children.
What did you do?
I have no family history of breast cancer. So if I
Right.
have breast cancer, what have I done to my daughters? Have
But
I now passed this on?
but you have no control over
I
that.
right. It's no control,
It's just the
not a
guilt,
bit,
though. Just the
just the
guilt.
guilt.
Okay. All right. Oh, that's heartbreaking.
Yeah.
So you were going. I can
Oh,
see it.
yeah.
You
I was going through it.
you were going through it. Now, how long did it take for you to get the results?
So they did the biopsy I want to say the 17th of September,
Mm-hmm.
and the 21st of September I got a call from my GYN, and she said, "I'm sorry to tell you this. On the left side you have a mastitis, but on the right side we found cancer."
Now they don't call you in the office for this. They tell you this.
She was actually leaving the practice, and it was her last week.
Okay.
So I think that's probably why, because she just wanted, so she called me. It was 10 o'clock in the morning,
Okay.
and she had me into a specialist by 4 o'clock in the afternoon.
Oh wow.
So I think it was, I'm leaving and I want to make sure you get this kind of taken care of. I'm not going to be
Right.
here to follow your care. So I hate to tell you this over the phone, but I need to tell you so you can get moving.
Well, thank God for her.
Right.
And she's no longer in the practice.
She's not.
Dr. P.
No, it was
Okay. Okay. I didn't want to say
not
name. I'm like,
Dr. P.
okay.
Not Dr. P.
Okay. All right. Okay. So you get this. Oh Lord. Okay. So you get this news. You get this news. Um. What did your husband? Was your husband with you? Were you alone? Were your husband with
I
you?
was alone. I was sitting. It wasn't the phone call I expected, so I didn't make
Of
sure
course
somebody
not.
was with me.
Right.
So
Right.
I was sitting and I was like, "Oh, they're calling me. Just they're going to tell me everything is fine," even though I knew. Um and she told me, and my husband was actually just downstairs. We had literally moved into our house August 1st. A month and a half later, we find out I have cancer. So he's unpacking the house because I had taken just enough time off work to move. He's taking care of the kids. And I look at him and I said, "They just told me I had cancer."
Just like that.
Just
Because
like
you were
that.
probably in shock. You
I
were
was
probably in shock.
shocked. I was shocked.
Okay. And this
Shocked.
is 2020.
It was 2 days before my 40th birthday. I wasn't even due for mammograms yet.
Right. Because you get that when you're 40.
Right.
Oh my God. Okay. So then you said you waited about a month before you started. Did you did you tell your mom right away or did you wait?
I waited.
Because she gets real nervous
Exactly.
as an understatement. She gets
Bunky, when I told her, she said, "No, you don't." I said, I do." She said, "No, no, you don't." I said, "I love you, but that's not the way this works. That's
wow.
not the way this works." And she freaks out. You know
Right.
her. You know how
Yes,
she can
yeah.
be.
I know. I know. You're going to get blood work. Oh my God. It's so extra.
Right.
I love her so much. So
Right.
so who did you after you told your husband? Now, you're number 2 of 7.
Right.
So you and the oldest girl.
Yes.
Do you tell any of your siblings when you find this out?
I waited about 2 weeks because I didn't know how. I don't know how to call somebody and be like, "Hey, I have this horrible news. I don't know anything really about it because at that time, when you get your first diagnosis, or at least when I got my first diagnosis, they could tell me no more than we found this cancer. They
Okay.
can't tell me how much is there, what stage it is, what
Okay.
my next step is until I have to go see an oncologist, which
Okay.
is something you never think you have to do. And he's got to do all this blood work and they have to do all these other tests before they can tell me what's going to happen next.
Okay. So the only person that is carrying
New
this with you is your husband.
is my husband.
That's a lot
It was
for
heavy.
him. Yeah.
Him
That's
and my daughter was 9. And I was so shocked when I told him, and I will never forgive myself for this. She was sitting behind me when I blurted out those words, and I didn't even realize she was there. So that's how she found out.
but you well, number one, forgive yourself. Number one, forgive yourself. You were in a state of shock.
Absolutely.
Like, I mean, because nobody knows how they would respond. Like
Right.
you were, it sounds like kind of, even though you were in shock, you were calm. I don't know if I would have not melted all the way into the ground. People respond differently.
Right.
So, so she knows now. She
She
knows.
knows. She knows from the 2 seconds after I know. She
Right.
knows. He
Uh-huh.
knows. And we're carrying this with us
For 2
for a
weeks.
little while till I go see the specialist,
Okay.
the plastic surgeon, and then I start telling my inner and outer circle because I know that I need
Support.
some support.
Right.
Right.
And your husband
That's when
couldn't do it by himself.
exactly. And he shouldn't have to carry that by himself. So
Right.
we told, who did I tell first? I want to say it was my youngest sister, only
Which I
because,
can understand.
right,
I can
because you
understand.
know her personality and she
Yes.
knows that she
And she's in the
deals with things
medical field.
and she's in the medical field.
Right.
So I kind of went, I want to say it was her, and then it was, uh, it was one by one. I went through them, but I believe I called everybody all of the same day and
Okay.
just let them know, like, this is what we need to do. This is what they've told me so far. I'm so sorry to do this to all of you guys, but I
It
kind of
wasn't
need you now.
your fault.
I know
What?
it's not.
I know. It's so apologetic. I'm
I
sorry.
was. I was
It
very
sounds like
apologetic.
it. It sounds
I
like it.
was, because I just dropped what I felt like was bomb on my entire family.
But you had no control over.
No control over. But
You
you
had no.
still think
Yeah.
I'm telling
You,
you, my thought was I am 40 years old because it was, like I said, just 2 days before my 40th birthday. And
right.
my entire life has just been flipped upside down.
Totally.
And I have to
Totally.
go and flip a bunch of people's lives upside down.
Right. You see that? You sitting there thinking about everybody else besides yourself.
Right.
See, that's the super kindness in you. That's that. That's that kindness in you. Okay, so what at that stage when they find a look? Is that stage 1? Like, what is that? How does that work?
So they don't do any. So I said, ask the oncologist that, where do I sit? Because I want to know what my next step is. Because I have to make some life decisions now.
Right. Right.
Where am I? Am I sick or am I really sick? He said, I can't tell you that till we get everything out. And then we have to send it for testing before I can give you a true, because they just put in a new system of staging.
Okay.
So I can't tell you anything until we get the lump out and when we have to send it for testing.
But what do you mean, are you sick or are you really sick?
Am I in stage 1 where nothing is spread, or am I already in a stage where it's metastatic and I have to start making some life choices?
Okay. So it hadn't spread.
At that time, we didn't know. We didn't know.
Okay, so you go in, you have that done. And your support system, once you get, like, how long after they give you the diagnosis, you're telling people that you have to go get the actual procedure? About how long?
So, diagnosis was 21st of September.
Right.
Surgery was October 24th,
Okay, so it was a month
a
between them.
month.
So all
So
this
in
time you're
that
walking
time,
around not knowing.
not knowing where I'm sitting, and every time I felt a cough, every time I didn't feel well, I was scared that this cancer is somewhere, they're going to find it someplace else
And
because
this
you
is
don't know.
COVID too, and not even
And
really.
it
I don't
and it's mid
2020.
COVID,
Right.
exactly.
So that's, oh my lord.
So I'm working in an emergency room with COVID patients and not feeling well and knowing I have cancer, and I can never be I was so fortunate because once I started to tell my support system, I have some of the most amazing coworkers in the world
Mhm.
who, if I needed to just go cry somewhere, they would just take care of everything that I needed, any patients I had at that time, or when we really got into the heart of it and I couldn't handle it anymore, they stepped up.
So you still work during it?
I worked during all of it. I took 4 weeks off after my first surgery because I ended up having to have two surgeries. I took 4 weeks off after the first one, and after they sent the tumor out. So it's such an odd process. Like you don't understand the process until you're in it. So I had a biopsy. I actually had two biopsies. They had to biopsy the spot they found on the left, they had to biopsy the spot they found on the right. But they did it 2 separate days. And I'll never forget this. The first biopsy I had the same nurse both times. And the first time I saw her, she said, "You're so young. It's not going to be a cancer." And when I came back for the second biopsy, she said, "I definitely didn't see that coming."
Wow.
So the two biopsies, you see the plastic surgeon for reconstruction because they want you to make this decision about what you're going to do, whether you're going to have just the part of the tumor taken out, which is the lumpectomy, or you're
Mhm.
going to have the mastectomy, single or double,
And they want to know that like right away?
right away. They want decisions. And I'm panicked because you can't even tell me how much cancer you found, but you want me to make this life changing, life altering decision about
Yes.
surgery.
Which isn't giving you time to talk to your husband, talk
Right,
to your family,
right,
pray about it,
right,
process it, nothing. Just I want to know now.
right. So I went back and forth. I actually went into the doctor's office 2 or 3 times and had back and forth decisions. And I ended up on my final decision because they couldn't tell me what my staging was. So
Uh-huh.
the way they put it to me was, if you have just the tumor taken out, you're going home that night. But if you
Okay.
have the double mastectomy, which is kind of where I was leaning at first, you're staying in the hospital and you'll go home the next day. And I
After a
said,
double
well,
mastectomy, they send you
yeah,
home the next day?
yeah, they keep you overnight just for pain control and they send you home the next day.
I don't understand that. I don't I don't I don't understand. I don't understand that. It's an amputation and they're
Basically.
sending you home the
And they
next
send
day.
you home the next day. They give you some
Wow.
pain meds. They tell you to come back and see us for your follow-ups.
I'm
I don't
feeling that
understand the
pain right
reasoning.
now. I don't understand that. I
I
don't.
don't understand the reasoning, but that's what I was told. And that actually made my decision for me.
Right.
I didn't know what they were going to tell me in the long run. And so I thought I'd just rather have a piece taken out and go home and be with my daughters because I don't know what time, right now, I don't know what time I have left.
Right. Well, our time isn't God's time.
Right,
So thank God for that.
right.
Thank God for that. So okay, you have the lumpectomy.
Yes.
And then what do you automatically get signed up for chemo, and do you get radiation? Like how does that work?
So to back up that part of it, they do the lumpectomy and they do pathology for the lumpectomy while you're on the table.
Pathology.
So
That's what is
while
that?
So what they're doing is they cut out what they think they see. So even before you go into surgery, you go for a final MRI where they
Okay.
line up where they see the tumors. They put in wiring so the doctor knows what to cut out. So while you're on the table, so I went in for surgery at 6 a.m. and I actually didn't get into surgery till 3 o'clock in the afternoon, and then didn't get out of the hospital till 9 o'clock at night.
Why?
Because they're doing all these testing. I have to have, again, another MRI for wiring. They had patients lined up in front of them. And even if I'm there at 6, I'm waiting. I'm just one of many surgeries they're doing that day.
Okay. So you're talking about wires. Are they putting the wires in?
Yes. They numb you up and they put the wires into
Wait,
the
numb
edges.
you up. You're not
Yes.
put asleep?
Not for that part.
Oh God. Okay.
So they do an MRI and then they send you into another room to do the guide wires. They numb you up and they put the wires into where they think the edges of the tumor are. So they know where they're slicing you open at.
I'm like so lightheaded right now.
Don't be.
Wow, they know I'm trying to process this. So I can't imagine what they numb you up with needles.
Yes.
They stick wires in you, probably like
Yep.
threading you.
Yep.
To find out where they're gonna stick another needle to pull something out.
Oh no, they're cutting you open. They're cutting that out.
Are you asleep yet?
I'm asleep when they do surgery.
Okay.
For wires and everything before that, I am wide awake.
Did you feel it?
The wires, no. They did a very good job of numbing you up.
Okay.
I watched it. That's nerve-wracking.
Okay. I'm like really getting lightheaded right now. I'm about to pass all the way out.
We can't finish this tea time without you, Bunky.
No,
you gotta stay up.
And because I've had this conversation, not this conversation. You know, I had when I had Nytishia on in July of last year. We had this we didn't talk about wires and stuff like it's a totally different conversation. Totally different.
I think everybody's experience is just a little different depending on what your choice to do is.
Right.
You're gonna have a different experience.
Okay. All right. So you go in, they take it out, and then they're doing.
So while you're on the table asleep, they're sending this to the lab to be dissected to make sure that they're getting all of the cancer cells out. So you're on the table for a while, because the first section they cut out didn't have what they call clean margins, which means at the edges they still saw cancer. So it means there's still more in there. They need to cut a little more.
Okay.
So they keep cutting out until they get everything. They get those clean margins and get everything out.
And all this time you're under.
I'm under.
Okay.
So I had a really wonderful team. So it wasn't only the specialist surgeon, it was also plastics. So when he gets everything out, he gets clean margins, the plastic surgeon comes in and does a reconstruction.
Oh, so so they're cutting stuff out. So there's like no dents and stuff. They're like, he does what?
They're rearranging what's left. Yes.
Wow. Okay. So was there more in there than they thought, or was it?
Yes.
It was more. Okay.
So it grew. So as I said before, it was a good thing I felt what I felt because it was growing under
the breast tissue.
Under in the breast tissue. I would have never known if it hadn't grown out that little lump that I felt. The breast specialist said you've probably been growing this between 2 and 5 years without knowing.
Look at God. So I could say, because looking at the whole picture now, that people don't know when I say the whole picture.
As somebody who was watching over me to make sure that I caught it that day. Because if
Excellent.
it had been, I am queen procrastinator when it comes to my own health.
Well, that's what
Nurses
I heard
are,
about you
we're
nurses.
terrible. We're
You
terrible.
nurses are the worst.
Listen, I worked with a nurse who was having a stroke, kept working, and then decided to get himself checked out. We are the worst. We do not take care of ourselves. I am queen procrastinator. The thought of having a mammogram was like, not something I need to worry about. I have no history in my family. And somebody was watching out for me that day, saying, something's not right here. Go get this looked at. Because
Now,
any
see,
other dad had been like, that's nothing. Who cares?
not me. I am what I follow those guidelines. Well, I'm this age. Okay, we got to get this done. All right, let's do this. Okay, I'm 50. We got to. No, that's me. Like when I had to get a procedure done, your mother was like, "Are you sure?
I
Are you sure
remember.
you?" Absolutely, I'm sure.
I
Let's do this.
remember
Are you? You sitting by my bedside stressing me out
stressing
because
me
you
out.
worried. So I can.
She freaks out about everyone's surgery. They're
Oh
gonna put you under, and I'm not sure you're gonna wake up. Gonna wake up.
I mean, like, she's the best, worst support you can have. The
Really, she
best,
is
worst.
extremely supportive,
She's
but her
really
anxiety will
her
get you.
anxiety will get you more worried about her. So I guess it's kind of good because you're so worried about her, you can't even focus
Right.
about like, look, I'm going to be. Are you going to be okay? Like
Are
I'm.
you right? Please don't pass out. I just need to breathe through it. I'll be
Right.
okay.
Oh my God, she's the worst. Oh God. So okay. So we get through that, right? Well, they do the constructions and all of that. So what happens after that? Like what do they talk to you while you're still in the hospital? Do you got to make an appointment for them to talk to you after? Like what happens?
So before you even go for surgery, they set you up for all your follow-up appointments. So
Okay.
after I got out of surgery, I go back to see the specialist, I go see plastics, and I go see the oncologist.
Now
Who
how
says
long? What's the time
within
frame?
3 weeks. So I went back
Within
to
3
work
weeks. Okay.
4 weeks. I went back to work 4 weeks, and by week 4, I had the answers for what my next steps were going to be. Um, they send the tumor out for testing for genetic markers, find out recurrence rate, and that determines what your next step is. So the tumor is tested to see, does it have a chance of coming back?
Uh-huh.
And that determined for me that I had to have chemotherapy.
So it came back.
No,
Is there
so
something in the gene that
in
can
the
tell them
gene that
if it can
will tell
reoccur?
them that this will grow back if you don't do X, Y, and Z.
Okay.
Yeah. So my tumor has a 97% chance of coming back
Before chemo.
before chemo. Having
Okay.
chemo knocks that down to, I believe he said 15%.
15%. Okay. Now with the chemo, like how does that work? Like what do they tell you? Because they have chemo pills now,
Right.
right?
Mm-hmm.
So do they tell you what the process is? Like you got to come like this certain amount of times, and how many chemo treatments did you go through before you got to ring the bell?
So
What?
4. I was very lucky. I only had to do 4 rounds. So it was every 3 weeks. I did a
Okay.
round of chemo for 4 total rounds.
Okay.
2 different types of chemo I had to do.
Okay.
And you have to do like medication before, medication the day of, the medication the day after to make sure that you don't have an allergic reaction to it. They
To the
give
chemo?
you to the chemo. There's a possibility of an allergic reaction to the chemo.
Okay.
So they give you steroids to suppress your system so you don't have a reaction to it. They give you anti-nausea meds. They give you more of the steroid when you're there. They give you anti-nausea medication before you start. And then because I had to do 2 rounds, which were each about an hour and a half, because they start chemo very slowly your first round, and every round they start it slowly until they figure out you can handle it. You're not going to have this reaction. So every round of chemo I had was about 3.5, 4 hours.
You had to sit, or can you move around and
You sit. You're sitting in a chair. So
stationary?
that's why you see people packing chemo bags. Even my first chemo bag, I posted on Facebook. I don't know if you saw the picture where I took a blanket with me. I took a book with me. I had such a wonderful support system. I had my sister's girlfriend sent me a blanket. My husband's aunt, my aunt-in-law, sent me anti-nausea, like lavender. I had comfortable socks. I had so much stuff to just keep me distracted because you don't realize the support system you have until you're going through something like this. I can never thank the people who stood in my corner when I was going through this, because at no point, even when felt I was at my loneliest, was I alone.
Right.
At no point. And I know that's off topic, but
No, it's not. No, it's not.
when I first found out I had to go through chemo, I was so worried that I wasn't going to be able to take care of my family, because I am the working mom. You know what I mean? My husband has been doing the stay-at-home dad thing since the baby was little because it just makes more sense for my family. So I didn't know how I was going to take care of my family if I had to go through rounds of chemo. And I scheduled my first round of chemo for a Wednesday, and I had to work that Saturday, and I was so sick I left work. So I knew that I wasn't going to be able to work in the immediate days after chemo. My coworkers did a fundraiser for me so that I could take that time off and heal and get myself back together. I would take about 10 days off after every round of chemo so I could go back and work until my next round of chemo.
Thank you to your coworkers for looking
They
out for
were
you like
amazing.
That.
They were amazing. I'm not going to name names because I don't know who wants to be shouted out and who doesn't.
Right. But
But
they know who they are.
they know who they are.
Right.
And I am grateful and thankful. And there's no way in the world I will ever be able to repay just the kindness they gave me. Between them and my family, they are the only reason I was able to keep standing on my own 2 feet. My husband's mom, my siblings, my mom, everybody coming through and making sure that I was able to rest, that I was able to not stress about having to take time off after every chemo round. Because chemo, I wouldn't wish chemo on my worst enemy. It is one of the worst things I have ever gone through in my life. One of the worst things in the world.
That's what I heard.
And I wasn't even having the Red Devil chemo. I was having.
I was going to ask you, did you have
No,
that red one?
I was lucky I wasn't the Red Devil. I was a couple levels under, and it was still, it's terrible. It's like having the flu 100 times over. I was in bed for days. I was sick. I was losing weight. My hair fell out. My eyebrows fell out. I couldn't function. It gives you, I couldn't think. You get so foggy, like your brain gets foggy. You're a different person during chemo. And after every round of chemo, you have to, so I would have a round of chemo on Wednesday, and then I have to go back to the doctors on Thursday for a shot for my white blood cell count so that I wouldn't get sick. They give you a shot that boosts your white cell count so you don't get sick. But doing that is painful because your body is producing that from your bones. So then you're in pain all the time from your bones trying to produce your white cells so that you don't get sick.
That's crazy.
Yeah. So when I say, luckily I only had 4 rounds, because 4 rounds was more than enough for me. And I've heard about people having to do 3 and 4 times that.
And you didn't have to get, now with breast cancer, do you know if people have to get radiation with that, or they don't do radiation with breast cancer?
No, I had 21 rounds of radiation after chemo.
So you had the radiation too?
Yes.
Did it burn you?
So I had some scarring. I have scar tissue. You can definitely, I can see it. I can feel it. The doctors can feel it. That it's another thing because that's every day. 5 days a week until all your rounds are done.
Wait, so you don't get chemo and radiation at the same time?
No, you
No.
don't get radiation until after you're finished with chemo.
So after you finish with chemo. And you had how many rounds of that?
21 rounds.
20. Do you get to ring a bell for that?
No.
You don't get to ring a bell for that?
Don't get to ring a bell for that.
Okay, so you had a plan then. Well, they had a plan for you when they found out the type of cancer you had, and
Mhm.
so your team came up with a plan and you guys discussed it, so you knew what was coming.
What was coming. So yeah, by the beginning of December, they had a plan in place. After surgery, they had a plan in place. You're going to do 4 rounds of chemo. When 4 rounds of chemo are done, you're going to do 21 rounds of radiation, which radiation is Monday through Friday, every day at the same time until 21 rounds are done.
And how long is that? How long is radiation?
Radiation is 5 minutes.
Okay.
So
But it's
radiation is
intense.
very quick. But it's intense. So your first round of is longer because they're lining you up. They use special padding to cover you in certain places and make sure that they're only radiating what needs to be radiated, the most minimal amount of skin, the most minimal amount of tissue. So they have to map all that out during your first round. So then your second, third to the 21st round, they can just lay you down. They have everything immediately lined up where it needs to be, and you're radiated and out the door.
So no more injecting of wires.
No more
inside.
injecting of wires.
Okay, so it's no, I'm just like that right there really made
You're
me
really,
lightheaded. Like
you really don't like those wires, huh?
no, because I never heard of the wires. You hear about chemo, you hear about radiation. The last show, that's when I found out about the Red Devil. Like you hear about but I never heard about the wires.
Yeah.
So everybody doesn't get the wires though. It
I don't
depends
think
on the
so.
type
I
of.
think it depends on the type of surgery. I think because I got the lumpectomy,
Mhm.
they were guide wires. This is where they need to cut. This is where we're seeing the start of the tumor. This is where we're seeing the end of the tumor.
Okay.
Just guide wires to tell them where to go.
Now, how big was the tumor? About
It turned out to be 5 by 3 centimeters, I want to say.
I don't know what that is.
So
Compare it to something like,
comparatively, it's a large tumor. They
but like
say
compared to a nickel, dime, quarter.
so it's about, let's say about 5 centimeters growing, but it's growing under, so you would have never seen it.
And that's big.
It's for breast tissue. It is.
Right.
It puts you into stage 2.
So you were in stage 2.
So
basically, kind of.
So the stages are very confusing because they just changed them up. Because there was something else in the tumor that kind of pushed me, even for sizing what stage I was supposed to be put in, pushed me back into the end of stage 1. So it's stages 1A, 1B, 2A, 2B. So I ended up in stage 1B. Even though my tumor was sized for stage 2, I end up in 1B because they said it's because it was very curable.
Thank God.
And it hadn't spread.
So the woman that you saw, that woman where it was coming out,
right?
She was like a 4B probably.
Probably.
And I'm sure it hurt. Did you feel pain for you? Did you feel any pain?
No. And I know that's a surprising thing to say, but I would have never known anything was wrong. There was never a time before surgery that it was painful. And it only became painful after surgery when the nerves started to grow back.
Right. But
there was never a time when there was pain.
You would have never known.
No. If I hadn't had a pea-sized lump, which is crazy because when they did the biopsy, I couldn't even feel it. That's how small the lump was. When they did the biopsy, they took it right from that lump. I couldn't even feel the lump anymore. But there was still so much under there.
Underneath. Okay.
Right.
So that part had to come out.
Right. That was just the little piece that had grown out.
Oh my God. God, that's crazy, girl.
Yeah.
Now the girls, they have to get the BRCA test? The
So I actually got the BRCA test,
okay,
and I have no gene for breast cancer. No one in my family has had breast cancer. They can't tell me what
where it came
happened.
from.
They don't know where it came from. They don't know what's going to happen. They think the girls will be fine, but they don't know.
But do
I thought I would be
they gotta
fine.
get tested?
So I want to have them tested, and because they now have a family history, they can get tested earlier.
Right. And that's like in their 20s, right?
Right.
And for guys too, you need to examine yourself because men don't
Guys
talk
don't
about it.
realize
They
they
can get
they
it
don't
too.
talk about it, and but if you have breast tissue, you have a possibility of getting breast cancer.
Right.
Anyone who has breast tissue, men or women, everybody should be doing these self
Self
exams.
exams. Now, being a nurse, would you know if a guy, let's say a guy's mom or grandmother or somebody had breast cancer, can they get tested for the gene?
They
Or is
should.
it different? Okay, they
As far
should.
as I know, they should be able to.
Okay.
I can't guarantee. I'd have to look into that.
Right. So
But
that was just a
if
random thought. Like,
right, but
can
if
they
you
get
have a family member, a parent who's tested positive, I
mhm.
don't see why not.
Man. Okay. So how are you feeling today? Like now, how after you've gone through all of that trauma, how do you feel today? Like, is there ever any anxiety?
Oh,
Like,
there's so much anxiety. So much anxiety. Every minute of anytime I get sick, what I miss most about, besides my eyebrows, I miss my eyebrows.
well, you can get them tattooed on. People get the tattoos. You know, they tattoo them.
We're doing everything now.
Yeah,
What I
tattoo
miss
them on.
besides my eyebrows is my sense of wellness. Because every time I get sick, I worry. Sorry about the dog.
It's
I don't
all
know what
right.
they hear.
Hey,
But
hey,
every time I get sick, I get concerned. Is it cancer again? Is it a simple cold? Is it I have a little pain in my back? Did something spread? Did something come back and spread and I don't know? I
wow.
the anxiety, I see a therapist and I see a mental health professional because of the anxiety,
Good for
because
you. Good for you.
thank you.
Talk about
I
it.
know a lot of people don't want to talk about it a lot, but my mental health, if I can keep my mental health in check, how do I help my kids? So that's
Right.
really important to me. And carrying that kind of anxiety, it was like feeling like you're having a heart attack every day, chest pain, because I'm always worried when I get sick. Is it
Mhm.
something else?
That's horrible.
It's a
That's
hard feeling. Miss that sense of feeling well.
right. And especially working in your profession, being a nurse. I
Right.
keep stressing y'all, she's a nurse, African American nurse. Um, being a nurse and seeing all the sickness
Right. You're
around you.
surrounded by that sick all day, whether it's people who are really sick or people who are think they're sick and aren't, or who are really sick. And at the peak, like I was going through chemo at the peak of COVID. Imagine if I had gotten COVID while I was going through chemo.
I can't even imagine because you have
Right.
no, your everything is wiped out, right?
Yeah,
Like
you have no immune
you have
system.
no
You're
immune
wiped out.
system.
And that's again where I have to say my coworkers, they wouldn't let me near anybody, any
Mhm.
patient who they even thought might have had COVID. They wouldn't. We had the COVID tent outside the hospital. I wasn't
That's
allowed to
love
go in
and
it.
support right there.
That
That's
was
love and
They gave
support.
me more love and support than I can ever even imagine from anybody. I had anyone who goes through this, I hope they have even half the support system that I had, because my support system was amazing. They really were.
And you probably didn't realize, well, you said it, you didn't realize that you had that.
Right. That you
What
have so many people standing in your corner rooting for you,
right.
helping you come through something that, like you said, is traumatic. It is a
Right.
traumatic experience going through, from finding out that you have cancer, from the hardest part, not knowing where it is, at what stage it's at,
Mhm.
what your next move is, going through chemo, being sick, watching my children watching me have to live this way, not being able to be the mother to them that I wanted to be. And still to this day, when I go to the doctor and I've never felt healthy. Never since chemo have I felt truly healthy. And the doctors say, well, chemo has messed with your body. And unfortunately, this is even 2 years out. You're probably never going to feel completely well again.
I can't even imagine what that feels like.
Right.
I don't I can't even imagine. I had my hypochondriac moments.
Mm-hmm.
I have, those moments. Um, but
I say that all the time.
it's
I
different
say
from
I've become a hypochondriac since this all happened. And people say, well, yeah, of course you have.
well, yeah.
Of course you have.
I mean, because one minute you're healthy,
And the
and the
next
next
minute you
minute
are down
got
with
wires coming out of you.
wires coming out of you.
It's like,
Oh,
I can't
Bucket,
get over these
listen to
wires. I can't. I mean, I'm not making light of it. I'm not.
I get it.
But I
Because I
just
said,
can't wrap my
yeah,
mind
when they
around.
said we're gonna put these guy wires in, I said, what do you mean?
Yes.
They're not small wires, they're very long wires, and they cut them and then they bend them so that you can still wear like your gown and they're not sticking straight out. That looks ridiculous.
Like the
Just
telephone wires. Like when you strip a cord, those colored wires.
yes.
Like,
Yep, they were silver wires just like that.
I'm getting all kind of anxiety. I'm just like, whoa.
You love these wires.
I can't. And nobody saw these wires but you and the people in the this was the
Nobody.
prep.
So me and the person who put him in, the nurse who was with him, the
Okay.
radiologist,
Uh-huh.
because again, peak of COVID, nobody could go to surgery with me. So
Right. Oh my God. That's
yeah.
another thing.
So I was in the hospital alone.
Oh my God.
I went to chemo alone. I did all this. Like I had a support system
On the
but sitting in
outside.
chemo, everybody outside because you couldn't have extra people with you.
Oh
Surgery
my
by
God.
myself. My husband couldn't go farther than the waiting room. When I went back and started changing everything, he had to go. So basically at 6 o'clock in the morning, he went in. 6:30, he had to go when they started getting me ready. Chemo, you're sitting by yourself. The nurses there were amazing, but you don't have, like, I didn't have him with me because he couldn't be.
Now, how is he doing? How is he? Like, does anybody ever ask him how he's doing?
I try. I do. To ask him how he's doing, and he's very honest that it was a struggle for him, and it's continued to be a little struggle because again, to watch me in that state was horrible for him. Right. To be concerned about me in that state. He's better now, definitely better, and I'm grateful that I had him to go through this with. I hate that we went through this, but I'm grateful it was him. I'm grateful for everything he did for me because
that'll break up a marriage.
That will break up.
That'll break up a marriage.
Listen,
so so he's a keeper.
He is 100% a keeper. I wouldn't trade him for all the money in the world. He is amazing. He's probably watching this in the next room, so I'm
smiling from ear to ear.
I'm going to deny I said any of it.
Well, no, you thank that man. You thank that man
every day. I thank him for standing by me, standing with me, going through it with me. Even I was sick as a dog. He was rubbing my back. He was getting my medicine when I couldn't get it. He was keeping the kids when I needed to sleep.
Right.
Like keeping them away from me because as you've seen the rambunctious one, if she wants to be around me, she'll fight tooth and nail to get to me. But when I needed to rest, he knew.
Right. Yeah, he was just support.
Oh, so much support.
He was just support. That's why he's your husband.
That's right.
That's why he's your husband. Thank God for him.
And my family in Long Island driving up here just to make sure I was okay.
And that Long Island is a hike.
That is a hike.
That's a hike. And I just don't understand how people just get in it in the car and drive like it's Monticello. I'm like,
right.
What?
I came out of surgery, and on that Saturday, his mom was here because she watched the kids. I am grateful and thankful for her. And Ash and Daniel and Courtney and Tikwa were at my door, and Sunday Donald was at my door,
Because
and
that's
Vance
just
came to see me, and
that's
Mom
who y'all are.
called.
That's who
That
y'all
is
are.
just, yeah,
That's who y'all are. For
that's
people
who we are.
that know you guys, that's who y'all are. Y'all.
They are my heart. My
Yeah.
family is my heart. They are
Yeah.
my everything.
Yeah, they
And
are.
without them, this would have been 10 times harder. Without their support, Ash was coming up calling Courtney, Daniel, Donald, all of them, just making sure they were listen. I got to the point where I said, the phone's ringing. I know it's one of them. I'll call him back after I wake up.
I know it's
I
one of
love you guys, but I'll call you back when I wake up.
that's good. That's you guys are amazing. I love y'all.
Yep.
I
Oh,
do.
oh,
I
and we
do.
love you.
You know I do. I
I
love
know.
y'all. It's just and I'm just so sorry that I didn't know. I probably wouldn't have been able. I probably would have gotten on your last nerve, but that's probably why I didn't know. And
No,
I'm trying to do better. I'm
you would
trying.
have never gotten on my last nerve.
Uh,
You would have been a part of that support system. And
oh, without a
I,
doubt,
without a
without
doubt,
a shadow of a
and
doubt.
I would
You
have
know.
loved every second of that.
Yeah, that's just a sign that I need to do better. Everybody needs to do better.
We all
You know,
do.
you
As
got
a
to randomly
family,
right. Got to check on
we
each
need
other,
to check on each other a little more.
right? Because you don't want to get hit with a bomb like that after the fact. Like, wait a
After the
minute,
fact.
what? Because
Like we
that's what
went
happened.
through,
I was like,
exactly. We were already going through something hard, and then I was like, oh, and by the way, this is what
yeah,
happened before this
yeah,
even started.
threw me for a whole loop. I'm like,
I know.
what? What?
I remember.
How did I miss that? I missed it because it was in COVID and I was bugging. I mean, we were all bugging out. We were
Right.
all, so that was a hard time.
A hard hit.
That was a hard hit. Um, well, ma'am, we got like um I told you it was gonna go
You were
fast.
not kidding. That hour flew by.
Yeah, we have it's 7:53, probably gonna be 7:58. I know, right? I'm telling you. So what is it that you would like people to know? What words of advice as a breast cancer survivor, as a nurse? This is your time now. What do you want to tell people? What do you want to tell people?
Take care of yourselves. Do those breast exams. Go for those physicals. You're not feeling well, tell the doctors. Don't ever think that what you're going through is little, because it may be a little part of a big thing, or maybe nothing, but you'd rather find out it's nothing than you waited too long and it was something. And that's, people are always telling me when they come to the hospital, oh, I didn't want to bother. Well, it's a good thing you showed up because you're having a heart attack.
Oh,
I'm telling you, I've had chest pain for days and I didn't want to be a bother. I'm sorry, I'm here. Good thing you showed up because you got a bowel obstruction. Don't be sorry to take care of your health, because you know what? You got to be around. People are in your corner. And before we go, I have to thank my huge support systems. Everyone. Jen, I know you're watching. Don't think I forgot about you. I definitely didn't. All of you, Ash, Daniel, Donald, Courtney, all my coworkers. I'm not going to name your names, but you know who you are. I love you all. I thank you all. I will never be able to repay your kindness. I appreciate everybody.
well, that's love. That's love,
So much.
lady.
There was so much love. Bunky, there
And,
was so much love.
and you got to feel it. That's the good thing.
Yes.
You got to feel it. It wasn't too late, like it just wasn't too late. And now
Bunky, they were
maybe the
dropping
love.
presents at my door. They were sending flowers. I
Right,
was
you was
getting
getting
cards.
gifts.
I was getting cards in the mail. Yes,
Right.
books so I could read. They were wonderful. And I will never be able to repay that kindness, and I will never be able to thank them enough. A fundraiser, so I could take care of my family. I will never be able to thank them enough.
That's love and support. I didn't see it. Why did I be like in my own world. I really do. I be in
Listen, And
I
that
be
was
in
me
my
not wanting to burden everybody else with what was going on. But at work,
well,
I had to. Like, I'm
right.
dragging, and they were stepping up
As coworkers
as
do and should.
coworkers too.
Right. They do and should.
More
So
more than I would have ever expected. Stepped up. Oh my god.
makes
Oh
it
my
better to go to work now with them, doesn't it?
Listen, I go to work with a smile on my face for the people I work with,
Right.
for
That
those who were
gratefulness,
there.
a grateful heart.
Yes.
Well, lady, is listen to her in the background. It is 8
You hear her?
p.m. I hear she's like, okay, it's time now. So thank you. Don't you
Thank you
go
for
nowhere.
having
You
me.
just wait
Thank
a
you for
minute.
letting me tell my story.
Don't go nowhere real quick.
I'm
You
not
stay
going
right here.
anywhere. Yep.
So for everybody, I thank you. I appreciate you. Like she said, make sure you get tested. Do your self exams, like in the middle of the night too. Do an exam, both men and female.
Absolutely.
When you're 40 years old, ladies and men, go get that mammogram. Go get
And
it.
if you have a family history, talk to your doctor about getting it earlier.
Yes, go and or go get that testing or whatever, because it's very, very important. As you heard, thank God she was caught early enough where she just had to deal with the wires and for treatment. Can't get over the wires. So you
Oh,
all have
Bunky.
a wonderful night. I appreciate you. Keep telling a friend to tell a friend. Like, share the podcast. Tell a friend. They can watch it on YouTube. And continue to support Tea Time with Bunky as we tell different stories and go down different roads. You don't want to miss what's coming up down the road, right?
No, you don't.
They don't
No,
want to
you
miss.
don't. It's
They
going to
don't
be
want to miss it.
great.
You're gonna be great. So you
Bunky,
guys
I'm
have
proud of you. You're wonderful.
thank thank you. I'm just doing what God called me to do and have a conversation. That's all I'm doing. So you all have a